welcome back to Driscoll Decoded. My name is Angela. We're in season 2, episode 2. Today we're talking about all things birth. We have 2 birth stories, 2 delivery stories, and 2 postpartum stories. It's me here, Angela, and then Jezlyn Bearden. Welcome. And then returning back to the podcast, Dr. Doucet.
Hello.
Yes,
Hi,
yes. So for the viewers who are just joining in today, can you give them a little background of what you do, what your role is at Driscoll Health Plan?
Yeah, for sure. So just real quick, I'm a native from Corpus Christi. So here with Driscoll is such a delight. I am the Associate Medical Director for the Women's Division, or Women's Health. And so I oversee all of things pregnancy and gynecologic surgeries, things like that. And so for the health plan, we're doing some really cool initiatives, implementing better strategies to improve health outcomes for both baby and mom. So that's what I do for the health plan.
Yeah.
My background is, I'm 25 years into OBGYN.
Ooh,
I was in
wow.
private practice for 19 years and really had a wonderful experience doing that, had some family changes. And so I jumped from private practice into a hospitalist role. So now I work at a local hospital as OBGYN hospitalist. So I still get to do the work,
Yeah.
but more available for my family. And I also own a medical aesthetics practice that I've had for 18 years. So, you know, everything like health and wellness and beauty. So it's just been a really cool delight of all the things I get to do.
Do you say med spa, right?
Do you say med spa, baby? Check me out. It's
Love
all good.
it.
Come see us.
Yes. Well, so welcome back. I'm
Yeah,
really
thanks
glad
for
to have
having
you back.
me.
Last time
Yeah.
we were here, I was about 7-8 months pregnant.
Yeah, man, we were exercising on
We
the
were
balls.
exercising?
Exercising on the
The
birth
only
balls.
time I got to actually try and induce labor, and we'll get that here in a little bit. But yeah, we were exercising in the gym. We were talking about pregnancy workouts, what was
Yep.
safe, what was not safe.
Yep.
So if you haven't seen that episode yet, go back to season 1, episode 7 or 8, and check that out. So I'm real excited about this one because we actually have another mom on the
I
podcast.
know.
Jezlyn, welcome.
Hey
Just
guys,
Decoded.
I'm glad to be
Welcome.
here.
Yeah, so as you can see, we're on location today. We're at Driscoll Children's Hospital just for a little change of scenery here.
Mm-hmm.
And we're going to be talking all about recapping on my birth experience, labor, delivery, postpartum, but we're also going to learn about Jezlyn's birth experience and everything about her journey.
Yeah, that's awesome.
Yeah.
I'm excited to hear about them.
So let's actually get into it. So Jezlyn, just tell me a little bit more about what you do and your
Yeah.
family and everything like that.
Yeah, so I am, like you said, a mom. I have 4 crazy boys, just lots of boys at my house. We're a family of 6. It's as chaotic as it sounds. My husband, I mean, you guys know who my husband is.
Yeah.
My husband runs a content marketing company, and right now I'm staying home and really just focusing on the kids because they take up so much of my time. I actually quit my job last year. And other than that, I do a lot on social media. So I'm a content creator, and that takes a little bit of my time, but it allows me to really focus on the kids and be very present. And so I'm really grateful for that.
No, that's awesome. And for the ones who don't know, her husband's actually the one behind the camera. You've seen him come on camera during our which one was it? Our dietitian episode. So he was able to get on camera for that one. So yeah, I'm real glad that you're here. You have a total different experience compared to me, and I'm glad Dr. Doucet is here because she can decode and all that and tell us just her insights as an expert and as a doctor into all of that. So we'll start with mine first, if anything, just because the audience already knows. So I was pregnant with my second child. My first girl, she is now going to be 5 April 1st.
Wow.
April Fools. And it was good, I would say. Everything was pretty well expected, I guess, like for the second pregnancy. Like you kind of know already going into it what to look out for, what to feel. And
Just to recap, how did your first delivery go in comparison?
Oh, yes. So we were in Houston, top of COVID, and it was so unexpected because I had no idea. It was just me and my husband, and I felt going into labor, just a little trickle of water. I was like, I've never felt that all my pregnancy. So I go in, get checked, and they're like, if you're not going to labor, go home and watch a movie because you'll never be able to do that again. And I was just like, okay, sure. And they're like, actually, you have to stay here.
So you're waiting for contractions to start.
Yes.
Okay.
And then we were getting ultrasounds. Like, let's just take you down to get some ultrasounds going. And I'm like, oh man, I'm feeling it now. And she's like, yeah, you're not gonna be able to go home. And I'm like, oh, great. Not gonna be able to go home and watch that movie that you said. And so we're just there.
Lucky you, though. That's nice when your water breaks and.
Okay, so yeah, that's what I thought. Like I said, I had no idea what to really expect. And then next thing I know, I was kind of getting all these medicines kind of pushed on me. And they're like, we need the Pitocin, you need this, you need that. I'm like, yeah, I guess, because during COVID, it was only just us two. No one else could be in the room.
And it's your first time.
My first time. So I'm trusting everything they're saying. And looking back, I didn't get to, go on the birthing ball. I didn't get to, try and walk out my baby. So all of a sudden, I know they say it's 24 hours past the breaking in the water. We need to do a C-section to prevent
infection.
And I'm like, okay, sure. So we do that. We get routine C-section, and everything's fine. But I got the epidural, and I'm on the table, and they're like, okay, can you feel it? Can you feel it? And I'm like, yeah, I can. When is it supposed to, I'm not supposed to feel anything. And basically what came down to it was I still felt them really tugging everything. It was the most uncomfortable, painful of anything sensation that I felt.
Yeah.
And I say that now because I had another C-section for my second, and I didn't feel anything at all.
Yeah.
Oh, wow.
Yeah. And I guess the difference was that I had that first time an epidural to help me go through the contractions. And then this time I had a spinal block.
Yes.
Yes.
So with your second delivery, which recently happened, did you try to have a trial of labor after cesarean, or did you just elect to have a repeat cesarean?
Good question. So yes, I wanted to have a VBAC, but my doctor said due to the scans that we were seeing, my baby's shoulders looked a little bit more larger to fit through.
Right.
So she's like, I don't want to risk anything. I don't want you trying to push her out, and she can't, and then it's really emergency C-section.
Right.
So I'm like, okay, that's fine. So we prepped for it. We planned it. We got the date. We went in. Everything was perfect. And then we walk into the labor and delivery, and you hear, moms, going through birth.
Yeah.
And I'm like, oh, my gosh.
That was me.
It was so quiet. And then we hear them, oh, no. I'm like, oh, I feel so bad just going to walk up in here.
You probably had makeup on and everything.
Yeah, I was freshly bathed.
Glamour girl.
I was freshly bathed, and I was like, okay, it's fine. I got my little headband and everything. And it was very nice and prepped. And like I said, going in the second time, knowing what to expect. Yeah. And they explained, okay, we're going to get this spinal block, and you're not going to feel anything. And they were right. I'm like, okay, great. And so I was laying down, and they said, we already started. I'm like, perfect.
What?
Wow.
Yeah. I was like, that's great.
Were you nervous that you were going to feel the discomfort again?
You can, hear it in my voice when I was talking to my husband.
Yeah.
And I was like, did we start yet? And she's like, yeah, we already started. I'm like, okay, great. She's like, and then when it was time to actually get the baby out, she's like, you're going to feel that pressure on your chest. That was the most, if anything, that was the most uncomfortable thing, because I literally felt that pressure of an elephant.
But compared to your first, was it different?
Yes.
Yeah.
And I would say I would probably be comfortable with doing another C-section, just knowing how fast and what
the healing and wow.
And how much did your second baby weigh?
So my first baby, she weighed 9'11". I did not know that. She was predicted at 7. I said, ma'am, nope. You said 7 pounds, and she came out 9'11". My second baby, she came out 8'16".
Okay, almost 9 pounds.
Yeah.
Well, there's 16 ounces in a pound, so she was.
Oh, okay.
So she was probably 8'15".
Yeah.
Or she would have been 9.
Yeah. Yeah.
I'm messing
she
with
was
you, girl.
8 something.
Yeah. So almost 9 pounds.
Okay,
yeah.
Great.
So you make super healthy babies.
I do, and that's what she said, and I was like, great. Sometimes you just make big babies.
Right.
I'm like, okay, it's I don't feel bad. But yeah, everything was perfectly. It went perfect, honestly. It was so seamless. The recovery was fine. I did get staples in, and that was the little scary part of like it coming out. But she's like, you're not gonna feel anything, and I didn't feel anything. Um, but other than that, I would say I would honestly have another C-section again.
See, when I was screaming, I was thinking, wow, I wish I would have done that.
Yeah.
I now being like a second C-section time mom, I appreciate it.
Yeah.
I appreciate the slowness of everything. Um,
The
go-
planning, the organization.
the organization. Yeah. Did it feel like a little downer? It did, because I wanted I wanted to be that mom. I wanted to feel
You
everything.
wanted the experience.
I wanted the experience. Yeah. But we were there, we were waiting, and we're the only ones there. And
Yeah.
so it was like, oh my gosh, like, and I told the nurse, and I guess it's something that you don't say, like, wow, y'all are really slow today.
Yeah. Never say that in a labor unit, girl.
And she, like,
I've heard that
quickly,
too,
she
yeah.
didn't even, like, let me. I was like, I'm so sorry. I don't know what else to talk about.
That's so funny. I'm just nervous.
Yeah.
Yeah.
So with my first pregnancy, with my first C-section, I felt like in my head, I thought I felt like the tearing, or not the tearing, the cutting and
Yeah.
the stretching. I felt everything because I had an epidural. This time around, I had a spinal block.
Yes.
And they explained why I felt that first time, why I felt everything.
Yeah.
Because my body wasn't prepared for a C-section.
Yeah.
So going in, I had a spinal block, and I didn't feel anything.
Yeah,
It was so
nice.
wonderful. But one thing I do have to say, what kind of gave me a little anxiety was not feeling my legs.
Yeah.
Like how you mentioned. That started freaking me out. I'm
Yeah.
like, oh, because I can't move. I
Right.
can't. Even though I didn't feel anything of
Mhm.
like the cutting, which was wonderful, it still gave me anxiety about
Yeah.
that.
Yeah. So I wanted to make a comment about your epidural not working the first time,
Yes.
maybe,
Mm-hmm.
and your spinal was like wonderful, right?
Yeah.
That's what she said. It doesn't mean, like, I want your audience to know that it doesn't mean that if you wind up being in labor with an epidural
Mhm.
and you have to get a C-section for whatever reason, medically indicated, then your epidural can be dosed to a level that allows a very comfortable C-section.
Okay.
So epidural versus spinal at a
Mhm.
C-section, it doesn't really matter. The difference is this. When you have a spinal anesthesia, there's a time clock there because it's only going to last for a certain
Yeah.
period of time,
Mm-hmm.
right? So just enough to
Oh.
get through the surgery and
Mhm.
your recovery, and that's it, and then it's gone.
Yeah.
So we as
Wow.
the surgeons
Yes.
have a very finite time to do that, but we're very proficient with C-sections, so it's really not that big of a deal. But
Especially scheduled.
yeah,
Yeah.
especially scheduled. So, but when you have an epidural, you have to dose it. This is what we say: can you dose it for a C-section? So that tells the
Ah.
CRNAs or the certified nurse anesthetists that they have to give a different concoction
Yeah.
at a different dose to hit a different level of pain control. So, just so that if you wind up going into labor
Mm-hmm.
and you need a C-section with your epidural, it doesn't mean you're going to, it just means to me that maybe they didn't get you to that level, or maybe there were circumstances of your first daughter that, they had to hurry.
Yeah.
I mean, there could have been many
yeah.
things
Yeah.
going on.
Many factors going into that. And also, I could have been just like really dramatic. But
Or maybe, do you think you perhaps felt more pressure than like actual like cutting
yeah.
pain?
So like I felt something, and I guess I'll just say to that. I felt something. Was it the actual cutting? I guess I will never know.
Yeah.
But I did feel something compared to the spinal.
Yeah,
block.
and they can
Yeah.
be different. Even before C-sections, whether it's an emergency or a scheduled or an unplanned that turns into a need for a
Mhm.
C-section,
Mhm.
we always test the skin to
Yeah.
see, we touch low, we touch medium, we touch high, and we can induce pain with
Mhm.
that touch that we do to make sure that the epidural or the spinal is appropriate to the surgery. So I don't know what the circumstance was, or did they test you or not, or
Yeah.
was it an sometimes when it's an emergency and it's a baby's life and we know the mom has some pain relief, we go for it because we're worried about the baby's life.
Of course.
So,
Yeah.
and moms understand that after the fact.
No,
but,
yeah.
but we don't want to hurt mom in any way.
Yeah.
But it just, circumstances are all different.
So, can people, because I've seen this on TikTok, can people can moms ask for the spinal block after they got the epidural?
That is not common.
Okay.
No. Sometimes I've seen where the epidurals aren't working, and so they'll pull out the epidural and give the spinal, but it's not common for the patient to say, oh, I really don't want to feel anything. I want my spinal now. That's not a common thing.
Gotcha.
So if we go to the OR and we prep and we're testing and they're still feeling with their epidural despite the dose to an adequate level for a C-section, sometimes the CRNA will say, it's not working. Let's just sit her up and let's do a spinal real quick. So that can happen. That's pretty uncommon.
Gotcha.
Wow.
So it was only for that allotted time that I was feeling like that, which I guess made me feel like, okay, well, this is easy. This is so much easier because
does
it
it
all
just
went
go
away.
away?
Yeah.
Wow.
Yeah. Like later that day, I was able to like move my legs, and the healing was, of course, still there with the stomach, but just, I guess, being prepared mentally of what to expect, it made everything so much easier.
Yeah.
And then like the only other like discomfort I felt was when they were actually getting the baby out, and she's like, okay, you're gonna feel pressure on your chest. I'm like, okay, I felt that pressure.
Yeah.
Like I literally, the way I describe it is like an elephant sitting on you.
Chest, yeah.
But it was only for a moment.
Yeah.
And I hear that's pretty normal.
Yeah.
Yeah, to feel that.
So when we're doing a C-section, we have to, the mom can't push for us, right, to deliver the baby. We have to do the pushing as the surgeon's delivering the baby. And so it's common that the assistant will put the hand like right on the top and push, like we're pushing the baby out, but you guys feel that right on your chest. Even though, and usually if I'm doing the delivery, you're going to feel some pressure now. You're going to feel a little pressure because we're doing the push instead of you.
Yeah.
Yeah. So that's not uncommon.
It was pretty insane.
Yeah.
And I just remember laying there.
Well, and the other thing, when you're getting a spinal, the CRNAs, the doctor will put a medicine in the spinal concoction that helps manage pain for about 24 hours after. We put something in there called Duramorphine is what they call it, and so that is a long-acting pain reliever.
Wow.
No, even though it was great.
Yeah, so even though you don't feel the pain of the surgery and the medicine that we use to get you through that acute part of the surgery, you still have a long-acting agent commonly in that spinal anesthetic to manage your pain.
In that initial.
Yeah, in that first 24 hours.
Right, now it's a major surgery.
Yeah, for sure. So that's why spinal is kind of nice in the fact that we can give a little extra something.
That sound nice.
I do have to say, compared to the epidural, the spinal did not hurt like that.
Oh.
It just felt like stinging, like as if
Ooh, I cringe when I think about the epidural. It's a weird feeling.
It is. The spinal, it felt like whenever like you put those patches on and you're like testing the vibrations.
Yeah.
That's what it felt like for me.
Okay.
Like just here and there, and they told me where it was gonna feel, and that was it. And then I lay down, and then everything just started happening.
Wow.
I asked her like, did we start? Like, oh yeah, we already started, and I'm like, okay, great. And so I think that just really helped with like the recovery in the hospital, at least.
Now there's a caveat to all this, and that is, I'm an advocate for trial of labor after C-section. And the reason is because the more C-sections you have, the riskier they are to you in terms of needing repeats and repeats and repeats and repeats and repeats. So scar tissue, placenta landing in the front where the old C-section scars are, that can lead to what we call placenta spectrum disorders, or where the placenta grows into the wall of the uterus and they don't detach properly at birth, and it can lead to bleeding. And so having multiple C-sections is not always a safe thing for mom.
Mm-hmm.
Wow.
And so, like, I'm an advocate for trying to have a vaginal birth, like we talked in the other podcast. But sometimes the circumstances just aren't in
Right.
your favor.
Yeah.
Like, your little one, she was too big for you.
Yeah.
Again.
Yeah.
And so, but I don't want your audience to think, oh, I've had a C-section, like let's just get another C-section, because it is a
Right.
wonderful
See,
experience.
that's what I thought too, though. Like,
Yeah.
well, now 2 C-sections in, do I have a chance at it?
Based on your history, highly unlikely.
Okay. Based on my history.
Yeah, because you make big babies. So what's the chance of you having like a little one
Yeah.
that can fit? And because you've had 2 prior C-section scars, you're very at risk for that scar opening, what we call
Right.
uterine rupture. And that puts
Which
your
is
life
like
in danger.
a life-threatening.
Life-threatening to the
condition.
mom and the baby both.
Yeah.
Wow.
And so, usually having 2 prior C-section scars is not commonly a candidate for vaginal birth, but it all depends on your story.
Your
and-
personal
yeah,
history.
yeah,
Right,
what the
right.
circumstances were. Did you deliver vaginally before, and then had 2 C-sections for a fetal reason, and then now you want to have I mean, it's hard to say, but it's not very common at all.
Yeah.
But having repeat C-section on top of C-section, once you start getting into number 3 and number 4 and number 5, it starts getting more risky for the mom. And so those are things to talk about with your OB/GYN when you're going in for another C-section. Like, how much scar tissue did I had? What did my uterine wall look like? I mean,
Oh,
these
wow.
are all things that
Wow.
are conversations with your OB at the time of your prenatal care.
Mm-hmm.
Thus
Okay.
is so important for women to go to get prenatal care.
Yes.
So these discussions can happen before, because unfortunately now as an OB/GYN hospitalist, as I was explaining to you, a lot of women aren't going in for care, or they'll go for one visit and then we see them at the
no.
end.
No way.
And then, there wasn't a plan for the delivery, whether it be for
Yeah.
repeat C-section or trial
Wow.
of labor or anything, preeclampsia and diabetes and all these things.
crazy.
But we're seeing it more commonly where women aren't getting prenatal care. So my plug is call to get prenatal
Wow.
care.
Yes.
Yeah.
Because we can be proactive and
I
help
always
women.
felt like those visits were like milestones, if anything.
Mhm.
Yeah, yeah.
Like I
Mhm.
made it another 4
Yeah.
weeks. See you. And then I
Very
remember
exciting.
when you switch to 2 weeks and you're like, okay, we're getting there.
Yeah.
And you're
Yeah.
going weekly and
yeah.
it's like,
Uh-huh.
see me again.
Mhm.
Check
it's
me
all-
again.
It's all about optimizing outcomes, right?
Right.
So having healthy mom, healthy baby. That's always the goal.
right.
And so checking. So this is the other plug that I'm going to make on your podcast,
No,
and that
go
is,
ahead.
check your benefits. I mean,
Yeah.
everybody should be able to get on insurance, and all you have to do is call 211. And what's happening commonly, and now the really cool news is that they've now passed law that women can be covered for 1 year after their delivery,
Yep.
which is huge. That's huge
Really?
for us.
Yes.
Yeah. That way that
Wow.
women that come into pregnancies with, let's say, chronic hypertension or type 2 diabetes or even type
Yeah.
1 diabetes or other medical conditions, we can optimize their health prior to the next conception to
Mm-hmm.
give
Right.
the baby and the mommy
Mhm.
the best outcome.
Right.
So the fact that we're able to extend that care for 1 year after
That's
is huge.
amazing.
Yeah.
Huge.
Yeah.
Yeah.
So 211
And I'm
to
thinking
check your benefits.
of all of the things that follow in the year afterwards.
Yep.
With birth control. and
Right.
Everything.
Yeah, I mean,
Yeah.
everything.
Proper birth spacing. We
Right.
know that mommies who deliver babies, too close together, like 6 months or less, they have a higher risk of preterm delivery, low birth weight. I mean, there's
Wow.
anemia in the mom. I mean, there's a lot of things about birth spacing and family planning that can
Yeah.
be done to optimize the outcome of the subsequent pregnancy or the
Right,
next pregnancy.
yes.
Right.
So, yeah, anyway, my little plug.
No.
But
yes.
but I'm glad that you had a good experience with your second C-section. Hopefully, you'll have another. That'd be kind of fun to go for the boy. But yeah, just so that your audience knows that just because you've had one C-section doesn't
Uh-huh.
necessarily mean you can't deliver vaginally.
Yeah.
Everybody's circumstances are unique, and that's worth discussing at your prenatal visits. But be mindful that oh, I'm just going to have another C-section, another C-section, another C-section,
Mm-hmm.
doesn't go without its risks as well.
So how was your? Tell me about your most recent. Okay, no, let's backtrack.
Yeah.
Tell me about
I can
your
do a
4
little-
pregnancies.
A little recap. So my first one I had when I was only 18. I was still a child, and so I had no idea what I was doing. It was kind of like, you said with your first, things just were happening, and I was like, okay,
Yeah,
whatever I need,
yeah.
do whatever. And so I think I went into the hospital around 8 p.m., and then somewhere in the middle of the night, I wasn't progressing fast enough, and they pushed Pitocin, and so that, of course, jump-started things, and then I think I had him at 8 a.m. So it was a 12-hour labor.
That's pretty fast
Other
for
than
a
that,
first-timer.
yeah, and
Yeah.
other than that, it was uneventful. It went great. My epidural worked. I didn't feel a thing. I remember the only part that I hated about the epidural was I was, shaking really violently,
Oh,
and
yeah,
then
yeah.
I ran a fever right after delivery, and
Oh.
I never knew why. I never knew. But back then, of course, this was 2014. I guess now it's a more common reaction to childbirth. I don't know if it was just a back then thing, but they took my baby because I was running a fever,
Oh.
and he was separated from me because they were worried that I was fighting something. And of course, now I know that
Is that
that's
normal?
It depends. I need to know more details.
Yeah,
like
I
how
don't
long
know.
Were you ruptured your membranes? Were you on antibiotic? I mean, there can be
so.
many
Yeah,
things.
they broke my water in before birth. So
Okay.
my water wasn't broken before then, and I think they pushed antibiotics right after I delivered because of the fever.
Right.
I know they were just concerned that I had some that I was fighting something, and they were trying to protect the baby. But
Yeah.
it turns out that's just the way my body reacts to childbirth because it's happened every time.
Oh,
Yeah.
wow.
It's interesting. Yeah.
Yeah.
So that was number one, very uneventful epidural. Went into labor naturally. I think I was 38 and 4, and so a little earlier for a first timer too, because I know most first time moms
Go
tend to go
overdue.
over. Yeah. My second, so there was an 8-year gap, and then I had my second. So that pregnancy was very different from the first one. I was sick as a dog. Like I think I was vomiting every day until I was like 20 weeks. It was horrible, and I got so extremely swollen. So I gained so much weight so quickly, and I think it was just because I was consuming as many carbs as I possibly could just to settle my stomach.
Yeah.
I remember I had to eat every hour. If I didn't eat something every hour,
Oh,
I would be
wow.
so sick. So it was tough, along with the swelling. That brings the pregnancy carpal tunnel. I remember I couldn't write. I couldn't hardly drive. It was a very rough pregnancy. And then I was like done. I was like, we're done. I
more
scheduled the
babies for
induction,
me.
put me
Yeah,
on the schedule, So we did that right at 39 weeks on the day. I was just beyond done and ready to not be pregnant anymore. And
So you
and
were
that
able to
was
schedule that?
yeah, I scheduled an
Wow.
elective induction,
Yeah.
39 weeks on the day.
That's a thing.
They won't do it before then, but if I was like, please just get him out now.
Why
Yeah.
do I feel like that was so hard for me?
Really?
Well, because you had a
Yeah.
previous C-section,
Oh.
and you were during COVID with your first,
Oh.
so you had
Yeah.
some obstacles.
And
Oh.
if you induce right, because the Pitocin could also, if you're trying for a VBAC,
Oh.
can't that increase your
Yeah,
risk?
not all physicians feel comfortable
Right.
giving a prior C-section scar Pitocin.
That's what I
Gotcha.
thought.
It's a practice style, but it definitely
So it
is
could be that
riskier.
because the inductions most of the time you're getting, like they started me on
Gotcha.
Pitocin. So, yeah. So that was also very uneventful. It was a wonderful delivery. I think that one, it was somewhere probably around 12 hours from start to finish. I had him the next morning
That's
after we
super
went
fast
in.
again.
Yeah, and it was great. I didn't feel a thing. The epidural worked wonderfully, and I think I actually remember I recorded in the room, like from the time that the doctor came in and said, "Okay, it's time to push," to the time they were weighing the baby was 11 minutes,
Mhm.
and so it was very fast.
Yeah.
Wow.
They said I'm a very effective pusher. I was like, great, cool, whatever.
These words.
I know. And then with number 3, he was our surprise baby. Actually, the last 2 were, but he was like shock. We were like, oh my God, we're doing this again. That was a wonderful pregnancy. It's so bizarre, like how different, and all boys, because they say the gender matters. It doesn't. And
It's
it
just
was
like how every child has a different personality.
right,
Oh, yeah.
So does every pregnancy.
right, and yeah, I'm like a real.
So it's like
testimony for
embedded,
that
like, even
because
before we know.
Yeah.
Mine were all very different. My 3rd pregnancy was an absolute breeze. I didn't gain any weight till the 3rd trimester.
Nice.
I wasn't swollen until the very end.
Nice.
I never was sick except maybe around week 6. I mean, it was wonderful. I was like glowing, long hair, long nails. It was like, I was like, I could do this again 3 more times.
Yeah.
Really amazing. And then to top it off, this is the 3rd kid. He's wonderful.
Yeah.
The delivery was incredible. I don't know what got into me with that 3rd child, but I was like, I can do this naturally. I'm just gonna do it unmedicated.
There you go.
I've done it twice already. I've gotten the epidurals and they were great, but I just wanted to
Have
really,
that
I just wanted
experience,
to have
right?
the experience.
Yeah.
Yeah, see if I could do it, and I didn't put pressure on myself. I remember telling my husband, like, if it comes down to it and I've got to have it, then I've got to have it. But
Yeah.
I'd like to try,
Mhm.
So we hired a birth doula,
Yeah.
and she was amazing, just a rock star. She helped me so much learn what to expect, and I felt so prepared. I had like affirmations on the wall, like you can do, real cheesy, like
Yeah.
encouraging things.
Whatever it takes, man.
Yeah, music playing,
Mhm.
essential oils going, and we just were like,
Wow.
we're gonna do this, and I can do it, and So,
And this was at the hospital?
and because it was at the
Okay.
hospital.
Nice.
Yeah, and I think for a long time I was thinking, there's no way I can have a natural, unmedicated birth in the hospital,
Mm-hmm.
just because of what you hear,
Yeah.
and even maybe a little bit of what I went through when I was 18, kind of the pushy decisions, and you have to be very well informed, and because it's something that they do all around the clock.
Yeah.
And it's not just that it's their fault. That's their job. And
Yeah.
so anyway, I had this mindset like, well, I'm going to have to do a birth center, or I'm going to have to do a home birth in order to have an unmedicated delivery. I think a lot of people kind of start to think
Yeah.
that how
Mhm.
hospital unmedicated delivery is difficult.
Mm-hmm.
And that really wasn't the case for me. Everybody was very supportive. There was a few, like there was a couple of decisions that I tried to make that were frowned upon. I think I was eating hot Cheetos while I was in labor.
Yeah. Usually not well received from our standpoint.
Don't try that at home.
Hot Cheetos.
Yeah. Other than that, I got in trouble. I definitely got in trouble for that. Other than that, though, it was wonderful. Like I remember thinking, okay, at 7 centimeters dilated, usually you're going through what they call transition, and so I was trying to prepare myself to get through the transition period because I knew that was going to be the most difficult. And it was just wonderful. Like obviously it's painful, but I used a TENS unit,
Mm-hmm.
and
Cool.
the TENS unit, it I don't even know what maybe you could tell us what it does.
Well, I've never seen anybody use a TENS unit for like a unmedicated birth, but I've seen things like imagery and
Yeah.
hypnosis
Like,
and things
oh my
like
gosh.
that. Yeah.
It stimulates,
It's a distraction.
it contracts your muscles.
Yes.
Oh, okay. Like
Yes.
the patches. that
Yeah, you put them on
Yeah.
your back, and it contracts your muscles in the back.
So your brain
your
is feeling the
brain-
back
Yes,
contractions
yes,
and
and
not
not
the
the
pain.
actual-
Yeah.
And it helped. It like big time.
That's
I had
so
it
cool.
Pack that in your
all the way up.
hospital bag, everybody.
Yeah, it was amazing, and I had such a great experience. I dilated pretty quickly, and I utilized the ball, and I
Mhm.
utilized all
Mhm.
these different tools that I didn't know that I could even do with my
Mhm.
with my previous two, kind of like you were saying, and it was incredible. And again, I think I pushed for right around 10 minutes, and it was intense. I definitely was very loud. But honestly, up until pushing, I was very composed. Now, I will say you're going to need this context for later. My water had not broken. My water never broke the whole time I was laboring. all the way up until the end, and they broke it right before I pushed. So that's important to just remember the little detail. My water hadn't broken. And so, we got right up to the end, and I pushed, and it was very, very intense, and then it was over. And just in a split second, like, just incredible. I don't know. I didn't know what to expect. I thought that it would be painful afterwards. And then I was thinking, well, if I tear, that's really going to suck because then I'm going to feel the stitches. And, I really had kind of hyped it up in my mind. But, I mean, it was immediate relief, just joy, baby bliss. And it's almost like it didn't even happen. It was bizarre. Recovery was incredible. And I would say even more so than the previous deliveries. It was just really great. So that was a wonderful experience.
That's amazing.
Yeah, that was number 3. So I had number 4 3 months ago.
Okay. Congratulations, by the way.
Thank you. And you too.
Oh, thank you.
Y'all both look amazing for having newborns at home.
Thank you. Thank
We
you.
tried.
We're tired.
Yeah, I would imagine.
It's the makeup.
It's the makeup.
So this pregnancy was enjoyable. It was kind of a mixture of all of them. I was definitely sick in the first trimester. In the second trimester, it got much better. I did deal with swelling and carpal tunnel, and all those normal grievances. I was very much done right around 35 weeks. I remember being like, Lord, I don't know if I can do this for another month. Like but I had 3 babies back to back as well. So I felt like at this point I've been pregnant my whole life and I was just done.
You're like really feeling it, like feeling those 3 pregnancies at that point.
At that point. And I could even feel like my bones, my joints, I could feel that I hadn't recovered from the previous 2.
I don't know.
That makes sense.
Yeah.
I don't know why this came into my head. That picture of Bella in Twilight. She's pregnant. Is that how you
Sucking
felt?
the life out of me. Yes.
Have you seen that?
No, I don't know what y'all are talking about.
Oh,
Okay, age gap.
Just had to be there.
just in that movie theater. She's real quick.
How do you even explain this to a person that has never seen
vampires? She is having a vampire baby, and she's very pregnant.
She's a human having a vampire baby.
Okay.
And she's very pregnant, and she's like dwindled to bones.
And so for
You're talking about the Twilight series.
Yes.
Oh, I
Yes.
thought you were talking about like some cartoon or something.
No.
No, I know. Like that kid almost kills her because she's like
Right.
so emaciated on the couch.
I was like,
or
is that
whatever.
how you?
Yeah, that's how you felt. Oh my goodness.
Yeah, basically like bones breaking. I was anemic.
Yes, got it.
It's like all the problems. That's pretty much what it was like.
Okay.
I was just done towards the
Well,
end.
and never mind the fact you had other children you were caring for
Yes.
on top of all that.
Yeah, which
Yeah.
changes the dynamic.
It does.
Completely. Because
Yep.
I remember thinking, like, what did I even do in my first pregnancy?
Yeah.
Take naps whenever I wanted? Wow.
Yeah.
That's,
Yeah.
not that pregnancy
Oh,
isn't hard, but
man.
it's like, it's a whole nother ball game
Yeah.
when
Yeah.
you're dealing with all of the physical ailments of pregnancy and the momming does not stop.
Yeah.
Right.
Your kids don't care.
Yeah.
Yeah.
They're like, oh, that's hard. I need a snack.
Yeah.
Like,
And your boys, how old were they?
so 2 and 1
2 and 1 and pregnant.
and pregnant.
Oh my
Very.
gosh,
Yeah, very pregnant. I had a 18-month-old and then a 2-year-old.
man.
Were they all in diapers still?
Yes. Yeah, all
Yeah,
in
that's a
diapers.
lot.
We just potty trained. Our son turned 3 this week, and we potty trained him a few weeks ago.
Nice. Congratulations.
Yes.
Yeah, we got
We're about to
one.
diapers
We got
off.
one.
Well, because all the kiddos are in different stages of diaper.
Yes.
And so when you go places, you have to have all the different
the
sizes and all
well,
the things.
yeah,
What
our
diapers do
middle
you
the
have?
middle one, he's a big old boy.
Yeah.
So they're actually in the same size.
Oh, that's awesome.
We call him Augie Chunks Bearden.
Oh, that's awesome.
He's a big boy.
Ay.
So thankfully they have been actually they've been in the same size since he was 6 months old.
Wow.
I
he
love
is
that.
Always
boy.
been just
I
he's
love that.
always had big thighs. So that we had that working for us. But yeah, now we've got one less baby in diapers.
That's good.
So anyway, it was hard towards the end, and I had gone in the pregnancy with the mentality of I had a wonderful unmedicated delivery. I'm going to do it again.
Yeah.
Mhm.
But the closer that I got, the more I freaked myself out. Like, okay, I'm grateful to have experienced that, but like, do I want to do that again?
Mhm.
You know, now that I know I've seen both, right?
Yeah.
I've had wonderful births with epidurals and I've had a wonderful unmedicated delivery, and I was like, do I feel like doing it again? You know, like I just wrestled with it. I think the whole time I wrestled with it, and I was
Mhm.
like, I don't know if I really want to
Mhm.
Yeah.
experience it twice. I kind of checked it off my list now, and
Yeah.
so I fourth baby. You know, this is the last time I'm going to do this. I really wanted it to be enjoyable,
Mhm.
and so I was very unsure. And I think that played a role even all the way up until when I was actually in labor. So I was doing all of the things, you know. I was curb walking. I was like eating the spicy food. I was getting the pedicures. I was like trying all of the things, like
Were you doing the
raspberry
juices?
leaf tea.
Remember we talked
eating
about that?
dates.
Yes, I do remember the juice. Yeah.
I was eating dates, which I
Yes.
mean, does any of that actually work?
No. But it's good to
For
try.
reference, everyone go back to season 1, episode probably 7 there. We talk about that more.
But whatever, if it makes you feel empowered to make it happen,
You're like, you go, girl.
why not?
You're wrong,
Yeah.
but
Yeah.
I love that.
well,
I did
Um,
I did go into labor on Thai food on my third kid, so
really.
maybe spicy. I don't know. That's
I
anecdotal.
believe the spices.
Castor oil.
Oh yeah, give me your thoughts on castor oil.
I don't know. That's more of like old wives' tale.
Yeah,
But I think that castor oil helps empty the bowels.
I've heard.
And so there's a lot of like contraction-y
Yeah.
things that happen. So maybe
So it could.
but I can't say off the top of my head without doing research.
Right.
Mhm.
Yeah.
Like, is there anything to back it up other than
Right.
you're emptying your bowels and you're
Yeah.
creating contraction?
yeah.
And so there
That
is
castor oil is sitting on my. It's sitting on
Yeah.
my shelf.
so
I
so
was
there
desperate.
is like
I never took it, but I thought about it.
Oh
there
my
is a
gosh.
natural evacuation that happens prior to labor
Right.
physiologically.
I've always heard
Yeah,
that.
so women will like have a bowel movement or they'll have diarrhea and they vomit. That commonly they vomit. Thus the hot spicy Cheetos or whatever that we don't want you guys eating because we know you're going to be vomiting and probably having some bowel movements because all that energy has to
Wow.
go to the womb
Yeah.
to push a baby out. So the body doesn't want to be using that energy to digest food. So
Wow.
we
Pregnancy's
naturally
wonderful, isn't it?
evacuate to whether it be from having a bowel movement or vomiting in order to focus that energy on labor. That's true.
Woo.
Incredible.
Yeah.
Wow.
Anyway, so maybe castor oil. I don't know.
Yeah. I was.
Did you do it?
desperate. No, I didn't. I was scared.
Oh.
I had, I was on the TikTok.
I did
And
do that
the
my first
TikTok-
pregnancy.
You did.
Did it work?
No, 'cause
I mean, no, she.
Okay.
I went
anecdotal.
past due date
Yeah.
and C-section.
No, what we'll
Did
say
not
to
work.
your audience is, okay, I'll go do the research.
Yes.
I'll get back to
Please,
you.
yes.
Yeah.
Do
Yeah.
the
What I've heard
research.
was I got on TikTok, right? And it's like midwives brew. It works.
yeah.
It works. All
That's
these
the
stories.
name.
It works. It works. And then it was like people in the comment sections were like, yeah, but it increases your risk of what is it called when they aspirate on the meconium?
Yeah, I don't know about that.
And so I was like, well, doesn't that rate increase anyway once you're past your due date?
Yes.
You know what I mean? So, I
Yes.
mean, I just, but it scared me.
Yeah.
Nonetheless,
Yeah.
it scared
Now,
me.
you
And I
were
wasn't
drinking
past
that
my due date
midwife's
yet either.
brew, weren't you, Angela?
Yeah,
I was like, you.
the first time. The first time.
Was
No,
it
the second
horrible?
time.
I remember that
It
of
was
your story.
disgusting. It was so disgusting, and I remember going to like the grocery
Wow,
store
you're
and like
brave.
picking up. I didn't
You're
know
wild for that.
I did, there was no TikTok back then, so like I did not know anything doing. But she,
Well,
she's great. She's
But you have to remember everything on TikTok is medically sound, right?
Right.
No, that's a joke.
If
yeah.
you follow
Yeah,
doctors.
be careful.
Disclaimer
Listen
there.
to your doctors and your nurse practitioners and your midwives. Just
Right. Don't eat the hot Cheetos.
Yeah, no
Yeah.
hot Cheetos.
No castor oil.
Covering all our bases here.
Maybe.
So
So I don't remember where I was.
So you were going into your birth
Yeah, I
process,
was
like,
doing all
were
the
you gonna use an
things.
epidural or not?
Right. I was
Yeah.
doing all the things to try to go into labor except that one. And I remember, when one of the early labor symptoms could be a bloody show,
Yeah.
right?
Mhm.
So we all know that.
Yeah.
I had never had that. and this is my 4th child,
Yeah.
right? So I'm in my mind, this is very untrue, but in my mind, I'm like, I've seen it all. I know, I know. I'm gonna know. I've done this 3 times already, and so I remember when it happened to me, it was just a lot more than I was anticipating.
Yeah.
So I called and I was like, I don't know that this is normal. And they were, they asked me about the amount and I told them and they were like, yeah, you should just come in and we'll look at it.
Yeah.
And so I was like, okay, well, I went in and we hadn't packed. I mean, we had like our big hospital bags in the car, but like, toiletries and all that we hadn't put in there yet because I hadn't gone into labor. And we were fully expecting them to tell me that it was normal and we could go back home. But I was just like, well, on the off chance that it isn't normal, I just want to get it checked. It's always better to be safe than sorry.
Absolutely.
They always, I will say, at the ER, they always made me feel like, you know what? At least you know.
Yeah.
Because I was there like 3 times. And anyway, it turns out they were like, well, you're in labor. That's why it is just a very prominent bloody show and you are in labor.
Wow.
And I was like,
I gotta go home.
wait,
I gotta get my bag.
we weren't ready. They were like, "Oh, you're not going home.
Yeah.
You're actively contracting." I think I was between a 4 and a 5,
Nice.
and I was bleeding, and they were like, "Yeah, you're not going home."
Oh my goodness.
So I was like, "Oh, it's happening.
Oh,
Like it's time."
Yeah.
And so I was so relieved and excited to get it going, and I was walking around the L&D thing while they were getting my room ready, and contractions. Actually, my husband had to leave because he you had to leave. It stopped my contractions.
He was probably going to get your bags and take care of the kids.
No. He was wrapping up a work project.
Oh!
He was wrapping up a work
threw
project.
under the bus.
He needed good Wi-Fi, and the hospital didn't have good
Okay.
Wi-Fi,
Wow.
and things weren't really moving and grooving yet. I knew that I had some time, and he was like at a coffee shop right nearby.
Yeah.
So he needed to wrap up this work project.
Wow.
My
Yeah, you're gonna edit that
my
out.
contractions stopped. I mean, like they were like every 3 or 4 minutes, and then they had just spaced way out.
Yeah.
What?
And my doula was like, "We need you to come back here because she needs the oxytocin, in her system." Like,
yeah.
and so anyway, he came back, and I'm really discouraged now because my contractions have way slowed down,
Yeah.
and I know how this goes, right? I know I'm taking up a bed. They could use this bed for somebody else. They're gonna need me to start progressing,
Yeah.
and so hours go by.
Wait, real quick. Why did it stop? Or did they tell you like?
It just
just
did.
stop?
Labor
Well,
can just stall,
It
right?
depends. I mean, had your cervix been checked at your doctor visits before that episode to the ER to get the blood?
Yes.
How far? Okay. How far dilated were you?
I was a 3.
So she was already baseline dilated.
Okay.
So
Okay.
she may not have been. Maybe you were dehydrated. There could be many things, but it's
wow.
many a time that patients present to the OBER and they're contracting regularly. We're like, yes, it's go time.
Right.
Let's get your IV
And
started.
I think they thought
then
since I was
once
now a 4 and at
Yeah.
at the
Yes.
doctor I was a 3,
Right.
so they
you're making a
they
change.
thought, but
Yeah.
I think it was what it was is I was just in early labor.
Yeah, and
I
then once
wasn't
we
in
add the
active
fluids,
labor.
then they start spacing out, and then we're like, oh man, that wasn't the real
False
McCoy yet.
Yeah.
Yeah, it was.
Yeah.
Yeah, it was early labor, yeah.
It was difficult too because I had experienced so much prodromal labor
Yeah,
for days. I mean, I would have these episodes where I would contract every 5 minutes. They were getting closer, they were getting
Yeah.
stronger, and then they would stop. And it was very discouraging for weeks. I dealt with that for weeks. So we're admitted, and I'm in the hospital room, and things have way slowed down, and we're trying everything that we can. I'm walking around. I'm even like curb walking on a little stool,
Yeah.
trying to move him into the right position, and hours go by, and we're just not going anywhere. And I think they checked, and I was maybe a 5 after hours.
Yeah.
So they were like, and I knew that we're going to have to do something.
Yeah.
Right. So they're like, we can either break your water or we can give you a whiff of Pitocin.
Yeah.
Well, I remember getting Pitocin during my induction and what those contractions were like.
Yeah.
Ungodly. Like, I mean, they were horrible. And they were so much more intense than my unmedicated delivery because I don't know if that's just the way that Pitocin works.
yeah.
but-
And I want to make a comment about that when
yeah,
you're done.
no, I'd love to hear it.
When you're done.
Okay.
Yeah, when you're done.
So, I remembered what it was like having Pitocin, and I was like, I don't think I'll be able to get through that unmedicated.
Yeah.
And I'd like to still try. And so why don't we just break my water?
Yeah.
Well, I didn't know that the contractions with your water broken are also much more intense.
Yes.
Much more intense than they are with your waters intact. I didn't know that because during my unmedicated delivery, my water had never broken
Yes.
until the very end. And so now I'm realizing,
Oh no.
oh no, is right. Yeah. I'm realizing now that the waters being intact really almost like muffled is the best way I can describe it, the pain of the contractions. And now it feels like, it's dry labor, and it was much worse.
Oh my goodness.
Much worse. So I think I was maybe a 5 or a 6, and I was already like, I'm done. Call the guy. I need the epidural right now.
Yeah.
And my sweet doula, she had been with me for my previous delivery, and so she was still really trying to, she's trying to do her job. She was just like, I know this is what you want. I know that you can do it. She was really trying to encourage me.
Yeah.
And I finally was like, I know I can do it. I don't want to do
Yeah.
it.
I choose not to.
and so she's doing exactly what I wanted her to do.
Yeah.
though. I had told her, if I get to the point, just encourage me, but I didn't know it was going to be like that.
Yeah. Yeah.
So anyway, I finally get the epidural, and I'm thinking like, I think I had been crying. I mean, it was very, very, very intense. Almost like what you see in the movies, where they're like
wow.
screaming.
Yeah.
Like it was very intense.
Never mind the fact you have 2 others that are like babies at home.
Right.
And all the
yeah,
stresses of
stress,
being a mom.
yeah, and
yeah.
having the prolonged prodromal
Yes.
labor and all the things, the false alarm, just knowing
very
that,
fast labors with your others.
right. And
yeah.
so knowing that this was just not going the way that I wanted it to
Right.
go, I think it really played a role in
For sure.
my mental state.
Yeah.
Yep.
And I was just really struggling, but I thought, okay, they're here. The epidural is here. I'm going to be able to relax. I was planning. So things weren't already not going the way that I wanted them to go, and it started to affect my mental state. And once the epidural, what is the doctor that gives the epidural called?
They're certified nurse anesthetist.
Okay.
Yeah.
Okay.
Well, once he got there, I was thinking like, okay, I'm going to take a nap. I'm going to eat a snack. I'm going to put some makeup on. Like I was already planning because
So
I've had 2 wonderful epidurals. And so I'm like, I'm not going to feel it. This is going to be awesome.
Yeah.
Yeah.
Like I'm going to rest. And the rest of this is going to be like a vacation because my other kids are not here.
Yeah.
It didn't work.
Yeah.
The epidural actually only numbed my legs.
Yeah.
Only my legs. And so now here I am feeling every
Oh my
bit of these
goodness.
contractions, except now I can't get up and
Oh.
I can't even labor. I can't even utilize any of the things that I was doing prior in my
Yeah.
prior birth to manage it. And I just
Anxiety that
didn't
would give
even,
me. Like not like
oh, I was a mess.
yeah.
I was a mess. I was just desperate for relief, and the contractions with the dry labor and it all was going south, and I was like, this is not what I don't want to do it. I can't do it. I don't want to do it. And I was crying. It was just it was not good.
Oh
It was
my
not good. And this, they came back and he was like, well, let me try to adjust your epidural, and they all told me that he was the best. And so I know it wasn't him. It was just something just weird happened with my epidural. And so, he tried, and I think they even turned it up, but it still just made my legs were just rocks, like just
Yeah.
dead. I was dead from the waist down, but everything in my midsection I could still very much feel. And so it was rough. And I did, however, with the epidural in my system, start to dilate very quickly.
Yeah.
So I'm grateful for that. And also with my water broken, like things happened very quickly. So that
Okay.
was about 3 hours of that real intense active labor. And
Man.
when it was time to push, I don't know how I didn't like pass out because I was not okay. I remember Grayson was looking at me. He was holding my hand, and he was just like, there's nothing that he can do.
Yeah.
He felt so helpless, and I could
Yeah.
see it in his eyes, and I was like, I'm gonna die.
You're like, I know.
I'm
I
gonna die.
know.
And it was time to push, and I was just like, you know what? I'm not afraid. I need this baby out right now.
Yeah.
And they kind of I started to hyperventilate. I was really panicking because of just the way that it was all playing out and the intensity of the contractions and my dead legs. And I was really starting to panic. And I remember my doctor was just like, the quickest way that you're going to get relief is to push the baby out.
Yes.
That's all you have to do now.
Yes.
You will have the relief once you push the baby out. And so I was like, okay, well, let's do it now. Let's do it now. Let's get this baby out. And of course he's born and I look, oh my God, I'm rough. I'm just like, I've been crying. I'm sweating. It was like very movie-esque. But of course, then there comes the relief and I just wanted to sleep after that.
Yeah.
And he was wonderful. And, then we're in our newborn bliss bubble. And I feel like I've already forgotten how crazy and horrible it was. But that last delivery was a rough one for me.
Oh my goodness.
I think
speechless,
what
really.
what I hear is that, all deliveries are different.
Yes.
And you
You're like,
had
yes.
3 lovely,
I did.
fantastic deliveries and one that didn't go as you planned,
Right.
but you still had a positive outcome, because I
Yes.
don't want your audience to be so freaked out and scared by your story,
Right.
because it's just unique.
No,
Yeah.
yeah.
And it
And I
doesn't
had
mean that it
had-
will be that way for all the audience that are expecting out there,
Right.
because things could have been maybe a little different, like maybe
Right.
pull out the epidural and get another one. I mean, there's options out there
Yes.
for your audience to know that, maybe, I don't know where your mind was, and I wasn't there at the time, but some intervention like, you know what, that epidural ain't working. I want my patient to be pain-free, or less pain. Let's take out the epidural. Let's give her a new one. Let's give her that
Yeah.
birth experience.
Yeah.
There are things that your advocates can do, your
There you
nurse,
go.
your doula, your doctor, to make that experience better.
Yeah.
Yes.
Unfortunately, you didn't have that experience, but
Right.
for your audience to know that it doesn't have to be so miserable.
Oh yeah. No,
right?
of course.
To give them hope,
and
like, oh my
again,
God, I don't want to
my
go into
first
labor
2
now.
Deliveries were textbook. Wonderful.
Yeah.
Epidurals and all, you
Yeah.
know. And so it was just a thing that
Yeah.
happened to me, and I didn't know that it even could happen.
Yeah.
Yeah.
I didn't know that your epidural could be a little wonky.
Yeah.
And
Mhm.
so anyway, it just it was rough.
I think it shows like right there that you had like 3 really good pregnancies and deliveries.
Mm-hmm.
And sometimes people think like, oh, like I don't want a C-section, like I don't want like the not picture perfect delivery, but like for my C-section it was also it went really well.
Right.
So we both had like great
And you
pros.
planned
Right.
it, and you were
Yeah.
prepared, and you
Mhm.
knew what to
Right.
expect.
It
Yeah.
really is just every pregnancy is different. Every
Right.
delivery is different, but just exactly what you said about having the advocates
Mhm.
Yeah.
advocate for you.
Yeah, and
Yeah.
being well informed
Right.
Mhm.
makes a huge
Also,
difference.
what I heard from your stories of all your deliveries is that I believe that unmedicated childbirth is a mind over body experience. I have experience. I have 4
Absolutely.
children, and I've experienced deliveries without epidurals, and so you have to set your mind
Yes.
and be focused. And
Yes.
so with your 3rd, you were go girl.
Yeah.
You were in the game for no epidural, right?
Yeah. From the
But with-
beginning.
right. But
Yeah.
with your 4th, if I
I
heard
was
your story,
wishy-washy.
you were like, well, maybe if I need it. So you always knew it was a tool, a tool in your box.
Yes.
And maybe that's
know, but
I
why.
do feel like that totally affected.
Yeah, it was your mind was
Mhm.
kind of not all in,
Right.
So that
There's
might have.
so much truth to that,
Yeah,
I would
yeah.
say.
Mhm.
And this is why
Absolutely.
we have an expert here.
Yeah. So
Thank you, Dr.
yeah.
Doucet. Yeah, no, that speaks so much truth. And that's why I'm so glad we're having this episode, because we get 2 different birth experiences
Yeah.
here
Yeah.
with you on the mic. And so you can like help us decode
Yeah.
everything that we just went through
Yeah.
and make sense of it.
What I was going to say, this is my opinion, and this is after 25 years of doing the work and caring for women and bringing babies into the world, which is such a blessing. And that is, I believe that when women have natural labor, there's there's what I call the crescendo. Like there's a slow onset of the contractions, and they're further apart, and then they get closer together and they get stronger, and it's like this crescendo, right?
Mm-hmm.
And so there's a slow onset of the intensity of the pain of the contraction. I personally believe that all contractions hurt equally bad. But there's an acclimation or an adjustment, I guess should say, to that intensity of pain over a period of time, right?
Yeah.
Just from caring for women in personal experience. I've had induced natural labor with no medicine. I've had induced labor with no medicine. So there's a difference in intensity is what you were alluding to.
Right.
But the difference with Pitocin is once we write for that order of Pitocin, it's like in your face contraction, right? Yeah. There's no acclimation. There's no adjustment. Yeah. There's no mental preparation. You are having a hard contraction. So I believe there's a difference in a patient experiencing that contraction from that slow natural onset up into that your face, you're having a contraction or it's go time, right?
Goodness, and so do they tend to be closer together as well?
That's all in relation to the amount of medication dose we're giving you. So we as providers can prescribe an amount of Pitocin, like, slow little contraction through the night, and then we're going to really put her in hard labor in the morning kind of thing. Or we can I really need this baby out. I'm worried about the mom. She's infected, or blood pressures are high, or whatever the situation. Or maybe I'm worried about the baby. We're going to go on the Pitocin now and really bang it out. But we have the ability to control based on dosing, and also the maternal uterine response to that dose. So some women may need just a little, like the splash, like your doctor said.
I wish I would have done it.
Whiff of Pitocin, but some patients need higher doses to get the same goal.
To jumpstart.
Yeah. Oh, wow.
So that's my impression. I'm sure people have studied the intensity of sensation of pain with non-induced and induced, but I think there's a difference in intensity because we're not letting the body naturally acclimate to that intensity.
It's like the equivalent of sticking your hand in hot water versus the water slowly warming up.
Exactly. Great analogy for sure. I believe that's part of it. That's what I was going to comment about.
Wow.
That's good to know.
My doctor mentioned as she was getting the baby out was that something was thin. She's like, oh, your cervix was thin?
Probably what we call the lower uterine segment was thin.
Okay.
That's where we make our incision to deliver a baby.
Okay. Because when I got rolled back to recovery, I was all, what does that mean? And the nurse there, she told me, she was like, she basically said, and literally in these words, that it's going to be hard for you to have another baby next time.
So if you ever hear things like that, or any of your audience here, you need to go back to your doctor and have he or she read the operative note, because they may not recall, because maybe they've done another 100 C-sections since then. To read the operative note and to explain to you what that means.
Okay.
Because that is important. If you had a very thin lower part of your uterus, that you're definitely at higher risk for uterine rupture.
That's what she was telling me.
Subsequent pregnancies. Yeah.
I was crying in the recovery room about my future baby.
Oh my God.
The baby I just had.
Yeah, right. Like, why are they telling you that then? But I think it's worth a conversation, right?
It is.
So another plug, on your podcast, and that is your postpartum care, right?
Yes.
So we're seeing a lot of women. They think it's all over and done, and I've had my perfect, beautiful baby, and I feel great, and it's all. I don't have to go back. No, you have to go back for your postpartum
I'm not
care.
going to lie. This time around, I almost was like, I'm fine. I've done this. I've done this 4 times. I know that I'm fine. I almost.
Yeah.
I had my hands so full with the other 3.
Yes.
Sorry, 4.
Yeah.
I have 4 now.
Yeah.
I had my hands so full. I was like, no, I'm fine. And my husband was like, you need to go.
Yeah.
Like, it doesn't even matter if they're all routine. You just never know. I went to my, 6-week postpartum visit that I thought was so unnecessary. And I had a really just terrible morning. I was so overwhelmed with my 4 kids.
Yeah.
Just overwhelmed, very freshly postpartum, very emotional. And I remember sitting there and, they make you fill out the questionnaire, ask you how you're feeling. And I treated it like I just, marked whatever on the thing.
Mhm.
And on paper, I was fine. But when she said, "How are you doing?" I broke down in tears. And I mean, I just broke. I was like, I'm not okay.
Yeah.
Actually, I'm not
Yeah.
okay.
Yeah.
And she, she started asking me some questions and, are you dealing with this? And are you dealing with this? And have you felt? And I was like, yeah, I actually have. Like, I've felt a lot of the things on this paper. I just don't, I treated it like a formality
Yeah.
because
Right.
I've done this so many times,
Yeah.
And she was like, okay, so you may be dealing with some mild symptoms of postpartum depression.
Yeah.
And I was like, what does that mean?
Mhm.
Like, I felt like, wow, I actually in the moment felt a little bit validated because what I was dealing with made me feel like I was crazy,
Yeah.
that I'm losing my mind with all these kids.
Yeah.
And then also that part of you is like, I don't want to verbalize this because then it becomes real. And I don't want your
Yeah.
medication. And it scared me, I think. And
Yeah.
so I was so glad when I left that appointment that I made sure to be diligent and go and just, even if everything had been perfectly fine, it's like you have to go to that 6-week checkup because
Right.
you don't know.
Well,
matter
and
how many kids you
that
have.
alludes to another important point, and one of the initiatives we're working on at Driscoll Health Plan, and that is depression screening. So the American College of OBGYN recommends screening like antenatally, first prenatal visit, later in the 3rd trimester, and at postpartum. That's the current recommendations,
Mhm.
and we're trying to initiate those among our providers,
Yeah.
across the health plan
Yeah.
network. Unfortunately, it's not completely launched out there. Not all practices are doing it, but with our maternal health home, we are.
Mhm.
And not only has it, I guess this is a bad term, what came to my mind, it's started with our members only within the health plan, but it's kind of bled over into all of their patients that they're caring for.
Oh wow.
So, and that's the
Wow.
goal. Like, we
Yeah.
want to improve healthcare for
Everyone.
everyone.
Yes.
Not just, our members. We want their care to be optimized, but by starting this initiative of depression screening, we're helping our members get care and closing
Yes.
that loop if they need help. But
Right.
now they've instituted it for all their patients, which is like for me a victory.
Mhm.
So,
Absolutely.
but the part of going to your antenatal visits and your postpartum visits for maternal screening for depression, and there's resources that can help women deal with
Right.
these struggles. Like, you had real struggle. You had 4 littles,
Yes.
and that's a lot. And not only validating what you were feeling, but also, like, some people are
Yes.
afraid to say, I think I am woman, hear me roar.
Yeah.
But it's okay to show your vulnerability
Yeah.
and to share that with your person.
I mean, my provider met me with so much kindness. She was just like, "Hey, I've actually felt what you're feeling
Yeah.
before, and I got through it, and I needed medication for a little bit. You may not, but I want you to know that if you continue to feel this way, give me a call.
Yeah.
There's ways that we can help you." And it just made me feel so supported and so safe
Right.
and not like I was crazy.
Right.
And she said, "I want you to think of it like this. It's the chemicals. It's
Mhm.
not you.
Yeah.
Right.
Yeah.
It's the chemicals in your brain. It's the chemical, it's the hormones that you're
Right.
feeling. It's not you."
Right.
And I just was crying. I was like, not okay. And I was
Yeah.
like, okay. Like, when I think of it that way, I'm removing myself from the situation.
Right.
Me and my pride, and I just it was a chemical thing. It was a
Right.
chemical
Mhm.
hormonal thing, and it was all right.
Mhm.
And even just that, I feel like helped me so much in my recovery. I ended up really not feeling like I needed to call back and get on the medication, but just knowing that I had that there,
Yeah.
knowing that I had a safe place to discuss these feelings with, and that there were options that could help me if I needed them. She was so kind, and I just was like, okay,
That's awesome.
and I felt better after that.
So
Pretty soon after
I
that.
do have to ask, because I feel like whenever I go into those, I can feel somewhat intimidated to answer, like, "Are you okay?" Like, "Yeah, I'm okay." Like, I,
Yeah.
for some reason, don't want to say I'm not okay.
Right.
And I guess like one of my fears is not being met with how the kindness that you were met with. Um, if people or if moms aren't met with the same kind of compassion and care, what advice would you give to them?
So first of all, you need to let your loved ones around you know how you're feeling too. So it's not just the mom that just had the baby, but she needs to help explain that to her partner, her mom, her cousin, whoever her closest people are.
Yeah.
Like, okay, I think there's something, I'm not going to fill out that form right, but I'm telling you, like, I don't feel right.
Yeah.
Yes.
And I know, like, on the Driscoll Driscoll's website,
Yeah.
and I think we're going to maybe attach it to your podcast, but there are resources there that are universal for everybody. It's not just for the health plan patients. But reaching out, there's a crisis hotline you can call, a national. All you have to do is just type in postpartum depression, and you're going to get like a gauntlet of resources. But we'll link them to the podcast where you can call and just maybe you don't want to tell or share your vulnerability.
Yeah.
But you still know, like, something's not right. I need to
Something's not
talk
right.
to somebody.
Yeah.
And you're not going to be turned into the police, and CPS is not going to come and get your kid. I mean,
Right.
the goal is to help moms deal with this transition.
Yes.
And
Yeah.
so the other thing that I wanted to mention is it's not just like a depression. Like, everybody goes through the blues.
Yes.
Because of the hormonal changes, your body hurts, you're
My
recovering
gosh,
from a
those
C-section.
blues.
Right.
Your coping mechanisms are just maxed out, right?
Yeah.
Right.
So it's okay to feel a little weepy and sad and crying and, oh my gosh, there's something wrong. But that does resolve. It's when they persist
Yeah.
Right.
and turn into a postpartum depression that our
Or
patients need help.
postpartum anxiety.
Anxiety.
I think that was also, that was looking back now, that was more of what I was dealing
Yeah.
with, like irrational fears, or
Like with everyone, or like
the baby.
The baby.
Yeah.
Just the baby.
Yeah.
And it was like I would like picture things happening that weren't happening and would never happen.
Yeah.
Right.
But I could see it,
Yes.
and
Yeah.
it was freaking me out.
Yeah.
And I remember being in the car with my husband, and I was so weepy. First of all, I think I cried every day, and part of that I know was just like you said, normal, like baby blues, and I could see where part of it wasn't. But I remember we were in the car, and I was like, there's something like not right with me right now. And he was like, well, what do you mean? And I was like, I'm afraid to tell you because I feel like you're going to think I'm crazy.
Yeah.
And he was like, babe, I would never think that you're crazy. You just had a baby.
Yeah.
Just tell me, and then we'll talk about it and we'll work through it, and you can tell your doctor. And I finally told him, I'm like picturing these horrible things that are not even happening in real life and wouldn't happen in real life, but I can see them in my mind. Like these scenarios that would play out with the baby, or just, I don't even know how to explain it other than totally not illogical
Yeah.
anxieties
Yes.
and fears. And
And that's a real thing. I mean,
Yeah.
the beauty of your story is just exactly what I alluded to, is talking to somebody
getting
close
it
to
out,
you, and
out of here.
yeah, and that way that person can be not the one feeling the experiences, but being able to help you work through that
Right.
anxiety,
And
or
point you in the right. And
Correct.
that is why it was really important for me when I was starting to feel like I'm fine. I'm so busy with my other kids. I can skip out on this 6-week visit. And he was like, no,
Yeah.
you're not going to skip.
Kudos,
You
man,
need to
to
go.
him.
You need to go to your appointment, and I'm so glad that I did, that I listened and didn't try to super mom it,
Yeah.
Yeah.
I don't
Again,
know
the
why we can
importance
get
of
into that.
postpartum care,
Agreed. That's so crazy that like the blues, it sounds like no matter how you say it, like we all experience it in a way the
Most
same
all
way.
women do. Yeah. it's
hormone
like
drop.
85% of women develop the blues. I mean, it's just a thing that we go through.
That's insane because it was the first day back. Okay, so we're adjusting to transitioning from one child to two.
Tough transition.
Which is, I didn't imagine it being tough. And we got home the first day, and my 4-year-old, the baby was crying. We weren't like, it was not a stressful environment. Everything was fine. I thought everything was fine. And I see her. I'm just gonna go to bed now. And it was like 7 p.m. and there's light outside. And I was like, why is she going to bed? Like
I've
I was,
ruined her.
yeah, I was like, she doesn't feel the love. Like all these thoughts started coming
Yeah.
to my head. And then I was taking the baby. I don't think it was that same day, or I don't even know what day that was. But I remember I was rinsing our baby in the tub, and I just started crying.
Yeah.
Like I just started crying, and um my husband came in and he's like, "What's wrong?" And I was like, "I know that you're not going back to work until like 2 more weeks, but I feel like you're going back to work right now, like tomorrow."
You're already anxious about.
Yeah.
And I was just like,
Being on your own.
being on my own. I was like, I don't know how I'm gonna do it. Like I can't do this without you. Like, and it was like, in that moment, everything just like hit me, and it was always around like the evening time, like always around like that 7 p.m., 6, 7, 8, that I would start feeling so anxious.
Yeah.
And it was like a dramatic, like I'm crying and everything's fine, but everything's gonna go bad.
Yeah.
And then it'll stop.
Yeah.
And then it'll stop. Like we'll
Mhm.
eat or something would change,
Mhm.
and it would just stop right there and then. But like, and then hearing like what you said, like it just
It might have
it
been a
fathoms
little bit of
me.
anxiety, but think about the people out there. I mean, this is where my mind goes. Like hearing your stories, and it sounds very common.
Mm-hmm.
But think about all those new moms that don't have a support person
Yeah,
at home to
exactly.
help them.
Yeah.
Yeah.
So the message is
Internalizing
make sure,
feelings.
make sure you reach out or have somebody on standby, whether that
Yeah.
be your cousin or your best friend or your mom or,
Mhm.
you know, your partner's mom or whatever,
Somebody.
somebody. So
A
in those
friend,
times
yeah.
of tears and
Mhm.
anxiety and fears and worries, that there's somebody you can
Yeah.
call.
And reach out for help.
Yes, reach out for help.
I don't know what it was with me with my when I had my second child, because again, I had my first so young. I like barely even remember. I was literally a teenager. But with my second, I think I tried to just like, no, my house needs to be cleaned. And
Yeah.
it doesn't matter that I just had a baby. I just really wanted everything to be so put
Perfect,
together,
yeah.
and I didn't ask for help, and I didn't want to accept help.
Yeah.
And I don't know what that super mom complex is and
Yeah.
why we get so carried away with feeling like we have to have it all together.
Yeah.
But it's horrible.
It's horrible.
It's being a brand new postpartum mom. It doesn't matter if it's your first, second, or fifth child. It's a very delicate state.
Yeah.
And you really got to reach out to whoever's around you to listen to your feelings, or to, can you guys maybe, I know that a lot of people have like these meal trains and
Yeah.
Oh,
and
yeah.
there's usually, if you have some sort of, I know that there's people that don't, but if you have some sort of avenue for support like that, like a village type support,
Yeah.
lean on them.
Yeah.
Like call on them. Ask, let
And
your
the way
mother-in-law sweep your floors, because
Well, and the way to think about that would be you would reciprocate, right?
of course,
You would give
Yeah.
back.
Mm-hmm.
If people are serving you, then in their time of need, you would reach out and help them.
right.
Mhm.
So at that time of vulnerability, receive the help.
Yeah.
Mhm.
Like be gracious and receive it, because when the tables are turned and maybe that person that's caring for you now might need you,
Yeah.
Yeah.
you're going to reciprocate. So it's
Right.
okay to say yes now, because you don't know when they will need you as well.
Right.
And so for people to think about it that way, because they're like, well, I would, I don't need anybody. I don't need anybody. But would you help them? Well, yeah, of course. Well, okay, you
Then
need a
let
little
them
help
help
right
you.
now.
Yeah.
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 So and I think that helps people receive the help more graciously
Absolutely.
and more accepting. Like
And these
I
can
don't
be
have
like
to be.
people from anywhere. Like it doesn't have
Yeah.
to be family
No.
or even like
Yeah.
friends. Like if you can
For
find
us,
in a
it
mom
was- It
group
was
or
people in our church for us.
There you
Yeah,
go,
yeah,
yeah.
your church
Mhm.
life or whatever,
mm-hmm.
your social network, whoever it
Mhm.
may be.
Mm-hmm.
Yeah, always have somebody on standby that you can call on for help.
Agreed.
Yeah.
I-
How about the recovery back to like feeling more like yourself, because your body goes through changes? How
I
did
am-
you guys do with all that?
I'm trying to find my pink again. I'm trying to do that. No, I think. Okay, one thing that's different with her is that so now we have our soon to be 5-year-old.
Yeah.
So now she occupies the other room.
Yes.
Compared to like when my 5-year-old was a baby, that was her room in her crib. So our newborn, sleeps in our room.
Right.
And these nights are so much harder than I remember
Yeah.
the first time around.
Mm-hmm.
And so that's what's bringing me not down, but it's just making postpartum much more harder.
Yeah.
Like everything is okay, everything is fine, but it's just that like the
sleep
lack
deprivation.
of sleep.
Yeah.
Yes.
Yeah.
And but I know it's not gonna last forever, and that's why I just have to like remind myself. But just like being gracious, I'm trying to learn this too, because there's something that I hear from my husband, like, why how come you can't see yourself the way I see you?
Yeah.
And I'm like, I'm
Oh.
trying. Like
Yeah,
I'm literally
it's
trying.
hard.
I'm
It's hard.
trying here. And I told him, just me like putting just like one thought behind, like throwing that thought away in my head, that's me trying there. And
Yeah.
like, okay, like, I might not feel the greatest in the way I look right now, but it is okay.
Yeah.
It is okay. And I think
You just gave life, girl. Yes.
Yeah, your body
You
did
have to
something
give yourself. Don't be
incredible.
so hard on yourself. Yeah.
and I think by trying to get that pink back, it's just like allowing, just even if it's the smallest time, like for me, like
Yes.
whether that's just a drive alone somewhere, or
Yeah,
which
getting your nails done.
getting my
or-
nails done, and
yeah.
even though it's like leans into the lack of sleep, like staying up just a little bit longer, just for like my mind just to like come together.
Yes. Sometimes that's more beneficial, I think, than actually getting that 30 minutes of sleep.
Yeah.
Right?
No, I agree. I definitely agree. And I think it's just taking that time, and then what's honestly helping me is having that time with my oldest.
Yeah.
Like just spending, just like
Sweet.
focusing time with her. It's kind of bringing me back to like, I'm a mom, but also I'm me. And I don't know, it's just
Yeah.
like a weird reminder that I didn't think I would find in her.
Yeah.
Like just spending
Right.
time with just her. But
The
yeah.
perspective. When
Mhm.
you have an older child, like my oldest now is 11. So I'm like, man, I know this is going to fly.
Yeah.
Even if it doesn't feel like it right now, I have this perspective of like, it's not going to be like, it's truly not going to be like this for very long.
Yeah.
It
you
goes so
they're
fast.
they're only little for such a little time. I can like still remember his toddler voice
Yes.
and potty training and all the things that I'm doing right now with my others.
Yeah.
And so that perspective I feel like helps a ton. But
I mean,
and
when
even
you guys
even
are,
with the physical recovery as well, it's like right now I tend just, I'm trying to word this in the right way, but I physically feel like myself again very quickly normally after giving birth.
Mhm.
Emotionally, no,
Yeah.
different.
but
Yeah.
physically, yes. And so obviously things are not the way that they were before. My stomach is squishy. I've got the stretch marks and the wrinkly, situation in my belly button is weird. And that's just the way it is. I was like, maybe I'm going to skip out on the 2 pieces this summer. That's fine. This is my body
Yeah.
now. And so even in my pregnancy, I had to have a cholecystectomy. Pregnancy wrecked my gallbladder.
Yeah.
Well, I should say back-to-back pregnancies wrecked my gallbladder. And so I had to have my gallbladder removed. So I've got that and the 5
man.
incisions.
Yeah.
And, and they're all over. It's
Mhm.
not like really well hidden. They're like all over and they're dark from
Mhm.
pregnancy. And so that bothers me. But, it's like there's an acceptance especially when you look at your kids and you're like, yeah, that was
Yeah.
worth it.
Yeah.
Of course it's worth it.
Totally.
And of course, I'm going to feel more physically like myself as time goes on. But right now, this time is just precious and it's truly fleeting.
Yeah.
That's where I'm at right now. Like that headspace, like I see my daughter, my oldest, like growing up so fast
Yeah.
and making those sentences, and like she's just gonna be in kindergarten next year, but it
Oh.
feels like I see her pre-K3 picture. I'm like, you were just a baby.
Yes.
Like,
yeah.
where did that time go? And then my 6-month-old, I'm like, okay, I'm gonna take
Yeah.
my time
You
with
will
you.
sleep through the night one day.
Yeah.
Mhm.
Yeah.
Well, you
That's
guys
how
are
we
both
feel.
in that time of mommyhood that's just hard because they need you all the time.
Around the clock.
And, you had mentioned that you left your work a year ago,
Mm-hmm.
but mommy is full-time,
Yeah. You
24/7, never ends.
Say
life.
it louder for the people in the back.
And
Yes.
it's hard. It's
Yeah.
hard.
Yeah.
And so, but you guys are in the thick of it.
Yeah.
We are.
Once they're, able to feed themselves and go to the bathroom, and it
You
gets
really-
better.
Barely.
It gets
You
better.
really do turn. I mean, I can recall feeling like, wow, we have arrived.
Yeah.
Yes.
My
Yeah.
son gets up in the morning, and I remember he would get up and grab a yogurt and sit on the couch and watch TV, and he wouldn't even wake me up.
Yeah.
And I was like, wow, we've arrived.
Yeah.
Like he was 6, 7, and starting to
Oh.
take his he goes and takes his showers, and it's like, wow, this is weird. Like the independence, it's coming.
Yeah.
It's coming,
It's
and
around the corner.
and where we're at right now, I have to remind myself of that with an older child, because the other ones are like I said, they're 3, 2, and well, he's
3
not even
months.
2. So actually they're 3 and 1 and just born
Mhm.
3 months ago. And we are believers in sleep training. I know that's controversial. We sleep train our kids when they're around 6 months old. And I just feel like that's the only way we would
Oh my gosh,
survive
I'm
them
gonna
being
need that
this close
guide from you.
together, because I'm already like, okay, this time right now that I was up all night last night with a baby that's
Yeah.
coughing and just not sleeping well. And I think he's hitting this 4-month regression just a little bit early. And it's okay, because it's just
Yeah.
for right now. And
And
I'm
it's in
tired
those
today,
moments,
but
like-
it's coming.
And
sleep is
late at
coming.
night, you're just looking at them and you're like, oh, I love you. Like, I'm
Yeah.
so tired.
I love you, but
you're
please go
so-
to sleep.
I think that's why God makes babies so cute.
Yep.
Because when you're so sleep deprived and you're hurting and you're tired and you're exhausted and you're crying, and then you look at that beautiful
They
face, you're
smile
like,
at you,
"I
and you're
love you."
almost like, yeah, I could do it again.
Yeah,
Uh-huh.
for
that
sure.
smile.
Mhm.
So adjusting through that postpartum. Oh, we're in it. We're in the thick of it right now.
So
But
speaking of perspective, your kids are obviously much older.
yes.
Yeah. So, as I mentioned you guys earlier, I've been married 31 years. So we have 4, and we have adult children and young adult children. So
Mhm.
right now we're at 25, 24.
Wow.
And then we have 19 and almost 17.
Oh,
So
wow.
we've been, I'm hearing your stories, and I'm
And
like,
you're like,
oh,
"Yep,
yeah, I
mhm."
remember how hard that was. There is a phase where it definitely gets easier, and traveling, and getting to school, and everybody, our kids made their own lunches, and so they made
Yeah.
their own lunches, and it's just gets easier. And then teenage,
Mhm.
has its challenges, and even young adulthood has its
Different
challenges.
yeah.
But I think looking back at y'all's phases of motherhood, and just hearing your stories, I'm thinking my take is just savor it,
Yeah.
because it doesn't last long, and they grow up, and those wonderful times of holding your daughter and just staring into her face, and just just like all gooey gaga in love. I mean, then you're not holding them like that anymore, and then they're giving you those quickie hugs like, I gotta go, Mom, and you're like, okay. So just savor that time, because right now it may be hard.
Yeah.
And especially for your audience out there, it's the hard phase, but it's precious.
Yeah.
Yeah.
You can't get that back,
Yeah.
and so just enjoy it. But the moms out there that are working, and as you are, and as you did for 3, being a full-time mom is no joke. I mean, you never get a break.
Yeah.
And I remember patients coming into the office, and they just wanted to chit chat longer, because it was adult conversation.
Yeah.
Right.
And so, not only the challenges of 24/7 meeting their needs and feeding them and changing them and cleaning and laundry and house and blah, 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 blah,
Oh yeah.
school demands, but,
Gosh,
just that want of adult conversation.
Yeah.
And then you having to go to work, and,
Mhm.
leaving the baby or whatever your situation is, it's hard. It's an
Mhm.
adjustment. And,
Yeah.
I worked with all my
Mhm.
pregnancies, and I mean, unfortunately, my story is different, and I won't get into that, but I didn't get postpartum leave. That wasn't a thing.
Oh my
So
goodness.
yeah, and so just the adjustment of like I just kept clicking and clicking because that's what you did
Wow.
at the time that I was having babies in my
What?
profession.
Yeah. Okay.
And so that adjustment, there wasn't really time. You just kind of survived it. And
Wow.
and so savoring, my advice is to savor it
Yeah.
because, I really didn't get to savor too much of that just because the hectic of my life. And many viewers may be in that same circumstance where
Yeah.
they may have a job or two and they're
Yeah.
just trying to make ends meet and put food on the
Yeah.
table or whatever they're having to do. And, take those moments for yourself. I think that's a good point. Realize it doesn't last long. We all make it through.
Yeah.
Your village is important.
Yeah.
Those things are important. And reach out and ask for help
Right.
if you really need it. I think
Yeah.
those are the big take homes because
Absolutely.
everybody's recovery is different and their village is different. And so, reach out to other moms, support groups, whatever you need to do.
Yes. I remember hearing a saying that you're always going to worry about your children, but as they get older, they're going to be different types of worries.
Oh, yeah. The worries never change. Yeah, that's a whole other podcast, girlfriend.
Yeah.
We
My
won't
mom
go into
says that all
Yeah.
the time. I'm like, I can't wait to be like you so I can just, what do we even do? Relax?
Yeah,
My
yeah.
mom was like, no,
It
I'm
never
still
ends.
worried. It's just different.
Yes. Oh my
Yeah, but
goodness.
just loving on your kids, love on them.
I couldn't agree more. Now I just really can't wait to get back home.
I know.
Yeah,
Get back home
right.
and see their faces.
Yeah, of course.
Well, thank you, Dr. Doucet.
Yeah,
for
more than
joining us.
happy.
Thank you, Jezlyn, for
Yeah,
joining
Yeah,
us.
y'all are
having
great
me.
stories.
Of course. Oh,
This is so fun.
this really was, and I'm glad our viewers got a lot of different perspectives here, different
Yeah.
stories, how just truly labor and delivery and postpartum is so different for everybody.
Yeah.
And this was just 3 different perspectives here.
Right.
Like it's gonna be a different. I'm sure there's definitely different stories out there. But for our viewers, if you like what you hear today, go ahead, subscribe, and like our video below. We will have all our resources linked after this episode and down below, so feel free to check all those out. You are never alone. If you don't have a village, build your village.
Yeah.
There's so many people in this world. There's groups of many, and just go ahead and look out for those people and build your village. And we hope you have a great pregnancy, a great
Yes.
delivery. You got this, Mom. But go ahead and stay tuned for our next episode coming up. Bye.
Bye.